Hi, my name is Ashley Teodorson-Taggart, and I am a graduate student in performance studies.
I'm Diana Cage, and I am a graduate student in performance studies.
Hi, I'm Celeste Navas, and I am a graduate student in cultural studies.
And hi, my name is Cruz, and I'm also a graduate student in cultural studies. On February 10th, the four of us met together with the collaboratory of the Beyond Health Working Group of the Feminist Research Institute at UC Davis to discuss our keyword for the month, which was reproductive justice. And so at that collaboratory meeting, we had these opening remarks, which I'll read now just to give us some context and situate us. So 25 years ago, US Black feminist activists coined the term reproductive justice to explain the needs of under-resourced women of color that were not being addressed in the mainstream women's rights movement. Reproductive justice, as expanded by other Asian, Latina, and Indigenous feminist scholarship, focuses not only on the choice to have or not to have children, but also the right to parent the children we have in safe and sustainable communities. As a framework, it supports analysis of the intersection of race, gender, class, and contexts, including environmental justice, incarceration, and healthcare, among others. As an established social movement and now emerging field of scholarship in critical race and gender studies, it marks the initiative to center the gendered and often racialized work of social reproduction in private life and in workplaces as a social necessity and responsibility. The reproductive justice movement has inspired women of color feminist scholars to extend current understanding of care beyond just individualized biomedical approaches to reconsider the structural and nature of health disparities. So now I guess we'll just open up the conversation. Our question that we talked about at the collaboratory was, what does reproductive justice mean to you? And I think we all have very different understandings and approaches. So maybe we could just go around and do that.
I think the first word I think of is access. And I think that's the thing that actually, the place that we need to begin. I mean, when I'm thinking about reproductive justice, it's first of all, where do we get it? How do we get it? And then after we've conceived or not conceived or whatever it is that we're looking for, how do we continue to have access to actually care for our children and take care of our family?
There's sort of this idea that the contemporary understanding of reproductive justice is really about this question of having children or not having children. And I think what I appreciate about the way that we approach this question here in this kind of group is that we're thinking a lot about yes, that those choices are incredibly important, but also, as you're kind of nodding toward this safety piece, right? This piece around community, around even environmental protection, access to healthcare. So this sort of ongoing piece, not just the decision to parent or not to parent, but what does it look like?
Yeah. And because I'm thinking about trans parenting and trans family planning and birth control, and what we need is access to trans competent healthcare providers. And so when I'm thinking about access, I'm also thinking about access to healthcare providers that actually understand what we need in our bodies and our health and that sort of thing.
I really love how you just started with the word access, because the current project I'm working on and wrapping up has to do with like abortion access. And and since I'm in history, our methods are a little like, they're very archive based, but the thing with having archive based research is that, at least for me as a woman of color, there aren't enough stories of women of color in the past. And the only thing I was able to find that wasn't about like social activism and reproductive justice, because that has been done in varying ways. I basically did all my work off of one book about the wrongful death of Rosie Jimenez, who was do you all know of her?
Or I've heard this, I know about it, I don't know.
Yeah, so she's the first known victim of the Hyde Amendment, which is the amendment that came like 3 years after Roe v. Wade, after the legalization of abortion, that barred working class women from abortion access. And she, like maybe a month or two after it became implemented in Texas, she became pregnant and she did not want to be pregnant. So she was used to Medicare funding the abortion, and then they no longer funded her abortion. So then she went out to go look for one. And essentially she went to go to a local midwife in her hometown, and this midwife didn't use any sterile tools, and so she got a bacteria infection in her uterus, and she died from it. So that's why I was thinking about like abortion and access, and thinking about those stories and how, you know, she became this symbol, and a lot of white feminists like kind of made her into an icon, but really, or like a martyr, but really she didn't die because she wanted to. Like, she died because the state in a way failed her.
Right.
So that's why I really loved thinking about access, like how that works. And that's why I also like the word community, because in between her figuring out that her health insurance no longer funded her abortion, and in between her death, her friends were actually like the ones helping her, trying to figure out where she could go. So she's in like McAllen, Texas, which is like 20 minutes from Mexico, and they thought that they could go and just put a bunch of hormones in her to miscarry, but that didn't work. And then they took her to Planned Parenthood, but they were like, we can't fund you because we don't have any more funding. And then one of them was like, well, I know this lady who I've heard gives out abortion, who does abortions on like under the table abortions. And so along the way, she had this community to help her, and they were really trying to figure it out. But in the end, this book also showed that her friends felt so guilty that they couldn't like help her pay for one. And instead they felt like they were the ones who killed her.
Oh.
So anyway, that's a very sad story. But I mean, it shows you the different, like the histories of what women have to endure just to have access to not like to even not wanting to parent a child because they can't afford one, you know. But with that said, oh, go ahead.
Oh, no, well, I mean, I just think that's really, the idea of community is, I mean, that's perfect. That's like such an interesting story about community.
Yeah, and
Sorry,
it just goes back to access, because all her friends knew of people that they could go to too, you know, and it's because they grew up and were raised working class, and you have to like make do when you're working class in America.
The factors that you're identifying, like class, race, history, those are all things that I think about because of reproductive justice. It's a framework that allows for that. And for me, I've read it as a theory that can help us think about like the reproduction of worlds. And, you know, I shout out to Michelle Murphy and Ruha Benjamin forever for helping me see that. But there's a sense in which this theory has become, insofar as it can robustly guide us to talk about race, class, gender, sexuality, like all those complexities and differences, there's a sense in which like it does kind of allow you to talk about everything. I think everything is a reproductive justice issue in some ways. And then that's where I get cautious, because I never want to disconnect from that very robust lived history that Celeste you're talking about, that Diana you were talking about. Like I never want to not have that be a part of my my approach, right? Because it has to stay accountable to that. And so that's when I get cautious, when I start to think about, okay, well, how do we talk about reproductive justice expansively? I want to talk about it on Mars. I want to talk about interplanetary reproductive justice. And for me, the methodological question, the values question, all the questions, the epistemology question, methodology, everything comes back to, okay, well, how do you think about reproductive justice as this theory that can hold that tension? Maybe I've been sort of thinking about, okay, well, I haven't been totally sure how to articulate it, but it's a tension that I don't think needs to be resolved. I think that it can hold it. I think
part of that, you know, also is about how do we as folks who are working in reproductive justice through the FRI continue to create interdisciplinary dialogue? You know, how do we continue to
Yeah.
reach out to folks who are working in the medical field and who are social workers and who are artists and, you know, and so forth, to continue to build that community and also to continue to loop in key members of care teams.